right, this will be our teaching video on vital signs. So what are vital signs? And this is the abbreviation VS for vital signs, so make sure you highlight that, circle it, remember it. Vital signs are important indicators of the health state of the body, and healthcare workers use vital signs to assess patient conditions and to make decisions about care. When you think about learning to take vital signs, I want you to think about taking a quick picture of what is happening with your patient. You guys are fabulous at taking pictures, and so I want you to, you're taking a snapshot of that moment in time, and that's exactly what we do when we take vital signs. We are able to see not everything that's going on in their body, but it gives us an indicator, and it really helps us make decisions about care. Think about an ER situation or any time that you have gone to the urgent care and you were really, really sick. Seeing your vital signs, that really lets us know, okay, what is going on with this patient? So you've looked at, our last two tests have had patient scenarios. So a patient comes in complaining of chest pain and their heart rate is 130. I mean, that tells us something, because that is too high, because as you've already learned, the normal heart rate is 60 to 100. So this is a snapshot of what is going on with our patient. If we've got somebody that comes in and their oxygen saturation is in the 80s as opposed to 95 to 100, we know that person has got to be seen very quickly. So the 5 main vital signs that we are going to study in this unit are pulse, abbreviated with a P, respirations, R, sometimes you'll see that as RR for respiratory rate, blood pressure, BP, temperature, T, and oxygen level, SpO2. There are other vital signs that are sometimes measured. Some textbooks will say that pain is the 6th vital sign, that every time you take pulse, respirations, blood pressure, temperature, and oxygen level, you should also ask about a pain level. But the 5 main ones in all the current literature and teaching are pulse, respirations, blood pressure, temperature, and oxygen level. So who checks vital signs? You know that registered nurses or licensed practical nurses will check both of those. The difference between an RN and a licensed practical nurse is just how long that they go to school. There are a few different job descriptions. For instance, licensed practical nurses cannot give IV push medications. That has to be overseen by a registered nurse. And there's some other variations as well. One of the awesome things about the nursing school programs right now in 2025 are that after the first 3 semesters, whether you go to Northwest Shoals or UNA or Calhoun, but you can, after those first, it's either 2 or 3 depending on the program, but they will tell you, then you can actually take the licensed practical nurse exam and become an LPN. And so then you can go ahead and start to work as an LPN, or continue on as an RN, or continue on as an RN and work as an LPN, just depending on what life is going on at the time. So definitely nurses take vital signs. Doctors have to be trained to take vital signs and need to know how to take vital signs. They don't take them that much, but they certainly have to know how to take them. A CNA, or a certified nursing assistant, or a PCT, that's a patient care tech, or students. So those of you that are juniors that want to go on to take the CNA class, or even if you're a 10th grader but you want to take the CNA class your senior year, this will be something that you will do daily as you do your clinicals. And anyone in the healthcare field, it's important for them to know how to take vital signs. So even if it's an x-ray technician or a EKG technician or a ultrasound tech, they still need to know how to take vital signs, because anyone that's in direct patient care needs to be able to take vital signs. If there's a change in the patient while they are with you, you need to be able to take this snapshot to know what's going on with your patient. And just so you know, everyone in a hospital, from housekeeping to doctors, nurses, the administration, and the people that work in the business office, all have to know how to do CPR. And it's the same type of CPR that you learned just a few weeks ago with the bag and mask and checking a carotid pulse and all that. Everybody knows how to do that even works in the hospital. It's part of the job requirement. But anyone that works with direct patient care needs to know how to check vital signs. When are vital signs checked? That would be upon admission. When the patient arrives, we need to know what's going on with them. The beginning of every shift change, and actually for most patient criteria, they are going to have vital signs checked every 8 hours. And most shifts are now 12 hours. But they will be checked every 8 hours. So if you work 7 a.m. to 7 p.m., you would be checking those at 7 a.m. and then at 3 p.m. And then when the nurse comes on, the next nurse or the next person, especially if you're in nursing, then they would check them at 7 p.m. when their shift starts, and then 8 hours later. So you need to have a baseline for what you're dealing with every shift change. And then any time that there is a change in the patient assessment. Let me go back. So if patient was fine at 7 a.m., but then at 12:30 they complain of shortness of breath, chest pain, then I'm definitely going to get another set of vital signs. All right, so we're going to start with pulse. Pulse is the pressure of the blood felt against the wall of an artery as the heart contracts and relaxes, or it beats. We are looking for two things when it comes to a pulse. We're looking for the number of beats per minute, which is the rate, and we are looking for the regularity, or the rhythm. You have seen both of these and heard both of these on when we did the arrhythmias, okay? When we looked at normal sinus rhythm, and when I had the monitor on and you heard what that sounded like, then you heard the rate, or excuse me, you know how to count the rate, okay? But the rhythm, that was that regularity. Was it beat, 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 or was it beat, 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 beat? Did it have an irregular rhythm? So for taking vital signs, you don't need to know if it's atrial fibrillation or any of the things that we talked about previously. You just need to know, is it regular or irregular? Okay, and you will be able to feel that in the patient if they have an irregular rhythm. We may not have any live patients or your classmates that have an irregular rhythm, but we can feel an irregular rhythm on nursing, and we will do that next week. So the pulse is most easily felt in arteries that lie close to the skin and can be pressed against a bone by the fingers. And the most common place to check it is the radial artery. So remember when we did the skeletal system and I told you to remember that the radius was on the thumb side. This is because the radial artery runs along the radius. So as you go to feel your own pulse here in a few minutes, and as we start to check your partner's pulses in a few minutes, then you will actually feel that radial artery, okay? And see it, you'll push it down, okay? And as we press it against that bone, then we can feel the pulse or the pressure. Okay, so take a second while this is up here and you see where to put your fingers, and you can use the first, second, and third, first and second, but it's on that thumb side, okay? So look at how the person is holding the hand they're taking the pulse with, though. That hand it's not bent way back, it's relaxed. So go ahead and relax your hand either on your leg or on the desk, and then try to feel your own pulse. If you can't find it, it's really okay. In a minute, we'll practice and maybe somebody else can find it. And if not, then I'll help you when I return. All right, I hope everybody found their own pulse. You don't want to use your thumb. It is just under the thumb, but you don't want to use your thumb to try to find your pulse or anyone else's, because the thumb has its own pulse, okay? So use your first 2 fingers or even the first 3 fingers. Other common pulse sites are the temporal, and this is where the temporal pulse, you may have felt this before if you've had a really bad headache and you felt it pulsating, or some other time, maybe when you've been running or something like that, you may feel the temporal pulse pulsating. This is the basis for the technology behind the temporal thermometer that we'll get to later on. Then we've got the carotid right here in the neck. This was the one that you checked with in CPR, because it is not affected by blood pressure. Okay, that's going to come up again in a minute. If the person has a pulse, it will be, if their heart is beating at all, they will have a carotid pulse. The apical pulse is the one that we listen to with the stethoscope. The brachial pulse, this is the one that we use to take blood pressure, which we will learn also. The femoral pulse, this is the one that, other than using it for doing stents and things like that for heart procedures, angioplasty, you may have to feel it if the patient has had some type of surgical procedure in the leg, but it is a big pulse, okay? But it's not used that often just for checking the pulse. The radial is the most common site. Popliteal is on the back of the leg, and then the dorsalis pedis or pedal pulses, those are in the feet. So after surgery on the leg, really the popliteal pulses and especially the pedal pulses need to be checked to make sure that that patient is still getting circulation. The radial pulse is not used in emergency. Instead, use the carotid or femoral artery because it is not affected by blood pressure. I would definitely highlight that, circle it, something like that. You will see it again. The normal resting adult pulse rate is 60 to 100 beats per minute. So BPM means beats per minute. You've already learned this, but this is just a reminder. And this is adult, okay? We're not going to learn child or infant because those are different. But for adults, the normal resting pulse rate is 60 to 100. So in a minute, when you start taking each other's pulses, it should be between 60 to 100, but we'll talk about some reasons why it might not be. All right, this is the end of video 1.